Hey guys, I just wanted to give a synopsis of an experience that I had yesterday. Had a patient come in, status post hospitalization. He was severely deconditioned. There were multiple issues that I found during the evaluation, and I called the doctor about the issues. This is where, I always say educate, educate, and overeducate, and it doesn't really matter who we're educating. It's our job to make sure that those that are referring to us and those that are coming to us know what we do. So I put the patient through testing, and the patient desaturated to less than 90%. The patient also demonstrated shortness of breath. Explained this to the doctor, and based on the ACSM's guidelines, that's an indication for pulmonary function test. And so I talked to the doctor about that, and he was kind of surprised that we knew that. He thought that was relegated to cardiac rehab. So I was a little dismayed that was his opinion, but apparently that was his experience with other physical therapists. One of the other things that we did was we looked at the 6-minute walk test. And there's a study out there, how fast does the Grim Reaper walk, that talks about gait speed. And people that walk less than 3 miles an hour had fewer, or had no incidents, or people that walk more than 3 miles an hour had no incidences with the Grim Reaper, meaning that they had no incidences of death within the next 5 years of doing this testing. And so I also educated the physician about that, and he wasn't aware as to how important gait speed was for overall patient health. So we had a fairly candid conversation. It was about a 30-minute conversation, actually. We had a fairly candid conversation about this patient, but not just about this patient, but about what physical therapists have to offer to patients. So go forth, educate physicians, educate referral sources, educate patients, educate nurses, educate other therapists. Do what you can to promote the profession that we're involved with. We spent a lot of time and a lot of money to do what we love doing for a living. Let's make sure that other people understand why we love doing it. All of us got into the business to help people. At least that's what I hear in most intakes when people are trying to get into PT school. All of us got into this business to help people. Let's make sure we're helping as many people as we can. So educate, educate, and overeducate. Salute.